Let's conclude this chapter with a few ideas on risk emerging from these disasters. In a regular classroom, this chapter would take at least several lectures because of the interaction and so on, whereas here I'm just running through them as podcasts, so I'm keeping it relatively brief. You can read the book and fill in the details, but don't think that this is such a short idea of extreme weather and risk, and combining with sustainable development, public health as part of climate mitigation and health risk reduction and so on. Okay, so disaster risk has formal definitions. Unfortunately, they don't all agree necessarily, but they include similar things. So probability of disaster risk is a function of the probability of the hazard and what we call vulnerability. And resilience. Resilience is the ability to recover from the shock. So it's some function of the multiplication of the probabilities of hazard and vulnerability, and is reduced by resilience. So if you are more resilient, you're not going to suffer as much from disaster risk. So just try to get an intuitive sense for it, but the concept metric does help because one can track whether the actions being taken are actually reducing the risk and so on. So in general, broadly speaking, risk is a function of hazard or threat and the uncertainty associated with those. The expected losses that you stand to lose are exposed, probability and impact, probability, vulnerability, and social factors, employment, per capita GDP, culture, and women's role, and so on. Likelihood and exposure to hazard, frequency, consequences, and preparedness. So there is one thing is risk reduction, the other thing is preparedness, which is of course part of risk reduction as well, and enhancing resiliency. Uncertainty, elements at risk, and community perception, whether people, for example, think of coronavirus as a risk, or they think it's no big deal and walk around without taking vaccinations and wearing masks and avoiding social distancing and so on and so forth. All kind of cultural factors are playing into the pandemic going around and not dissipating as quickly as it should or could, right? In a broader sense, also disaster risk management would include threat recognition, risk and vulnerability identification, risk analysis and assessment. So you have maps of risk analysis and metric of risk at each location at some proper governance level. Risk control options like structural, non-structural, cost-benefit analysis, and so on. Strategic planning, economic, political, and institutional support considerations. So you can think of those as gaps that can hurt or can act as barriers to disaster risk management. Response, recovery, reconstruction, and rehabilitation. So that's the resiliency in the system. Knowledge management, sustainable development, resilience building, and community participation. So obviously kind of motherhood statements, but each one can come with a metric so that risk management can be done in a quantitative way. To look at it another way, reducing the risk of disaster-related adverse health effects. Health-related disaster risk due to extreme weather events occurs as the result of convergence of 4 key factors. This is from the IPCC report from 2011. The presence of a health hazard associated with an extreme weather and climate events, commonly considered as a function of frequency and impact. How often floods may happen, extreme rainfall may happen, droughts may happen, heat waves may come, cyclones may come, and so on. The degree of exposure to the hazard sustained by the person or population, the degree of vulnerability of the person or population to that particular health hazard, and the degree of resilience of the person or population in order to avoid or moderate harm. doing it this way tells you that you can manage disaster and reduce disaster risk by avoiding hazards, by minimizing exposure, by reducing vulnerability, and by enhancing resilience. Okay, sounds good, but of course there are barriers to each and there are limitations to each, and there are of course other socioeconomic and other factors involved: governance, stability, per capita GDP, and so on. Education can be a factor as well. So here is an example of short and long-term exposure reduction measures for extreme weather events. You can look at hazards like landslides, storms, floods, heat waves, wildfires, and drought. Short-term exposure reduction includes, for example, evacuation of hazard zones near hillsides during the monsoon, for example, evacuation of coastal areas and floodplains, evacuation of floodplains, heat waves, so evacuation of high-risk urban housing. Socioeconomics affect the outcome of heat waves even in a rich country like US, in Chicago, Philadelphia, New York, elsewhere. Poor people tend to pay a high price for heat waves. Evacuation of areas near fire spread for wildfires, evacuation or migration or shelter in place with relief and public services for droughts. Okay. Long-term exposure reductions include land use patterns, so these are much more of governance, policy, incentivization, and other issues, implementation. Developmental practices, natural resource conservation. For storms, land use patterns, development practices, building construction, zoning regulation, floodplain management. And for floods, land use patterns again, developmental practices again, building construction, zoning regulation, floodplain management. So there are many examples where people were allowed to settle in floodplains, and then like the Mississippi, for example, and when floods do happen, there is all a helter-skelter about whether they were exposed by lack of information or whether they voluntarily put themselves in a floodplain. Heat waves again, land use pattern, developmental practices, urban planning, building construction, zoning regulation, natural resource conservation. So trees are now considered best tools for dealing with heat waves in urban areas. Urbanization in general exacerbates impacts of heat waves, for example. Wildfires, land use patterns, developmental practices, urban planning, building construction, zoning regulation. You can see how many things are common at long-term exposure reduction. Droughts also include long-term exposure reduction measures in land use patterns, developmental practices, urban planning, agricultural and forestry practices, zoning regulations, natural resource conservation, and watershed management. So people getting closer and closer to forests and woods and living in wildfire zones, and even human management of wildfires can actually act counterintuitively to increase fuel for the fires and so on. Okay, so building healthy and resilient people and communities has this kind of a typology. I won't go through the whole thing. This is from a nice review article. So here you have broad themes in community health resilience and key components of community health resilience. So health at the center. Everyday resilience supports disaster resilience. So this is putting public health right into disaster management, sustainable development, climate mitigation, land use patterns, and so on. Natural resource management, connecting people and systems. Again, key part of sustainable development. Accessible services to robust public health, healthcare and behavioral healthcare systems promote community health resilience, and so on. Okay, so the idea is that now this is one holistic system that comes down to health underpinning all other resilience efforts, and community health resilience being inseparable from overall community resilience. Okay, so in that sense, the 2030 Agenda for Sustainable Development Goals should recognize close linkages between climate options and sustainable development. Disaster risk reduction is essential for sustainable development. So Paris Agreement cannot be dealt with separately from the disaster risk reduction framework that evolved in Sendai just recently, and the 2030 SDGs, or Sustainable Development Goals. And there are, of course, feedbacks between them. So highlights the role of adverse climate change impacts in undermining sustainable development, acknowledges that UNFCCC is the primary forum negotiating the global response to climate change. Here, reference to Sendai framework includes targets related to disaster risk reduction, and between Sendai framework and Paris Agreement, note that addressing climate change is the mandate of the United Nations Framework Convention on Climate Change, and this recognizes climate change as a driver of disaster risk. So anything we need to do disaster risk reduction has to keep these intimate interactions in terms of direct references and thematic linkages in this IISD report. Okay, International Institute for Sustainable Development Institute. So that is kind of the goal of this chapter, to give you a sense of how each of these things are related. Extreme weather events, which bring disasters, elevate health risks, expose communities and individuals to health risks, and now they are all exacerbated by climate change. So climate change adaptation and mitigation and sustainable development must make choices in land use pattern, urbanization, natural resource management, agriculture, renewable energies, infrastructure, zoning, and so on and so forth, to put public health right at the center of overall resilience, individual and community resilience. Okay.